Another great office-based treatment is eliminating dark circles under the eyes, and it's one of my favorite treatments to perform in the office because it gives us such a dramatic result, and it's relatively easy from the patient's perspective. New technology has actually made this even a better treatment. So as we age, we lose fat from the face, and as we lose fat, we start to get hollow, and one of the first areas we see that is dark circles under our eyes, and these can be corrected with a delicate technique called cannula technique. So we use fillers, and there's a variety of different fillers that can be used for this, and we use a cannula rather than a needle and making multiple pokes to put the filler into the tissue to fill in the hollow. I make one little poke with a needle, and then the cannula is a blunt-tipped instrument. It looks like a needle because it's long and narrow, but instead of having a sharp tip, it has a blunt tip and a tiny little hole on the side near the end. And you can pass this delicate cannula under the tissues and delicately layer the filler in. So it's very artistic because we do a little bit at a time, layer that into the deeper layers to correct the hollowness. And that can be used for the lower eyelid as well as the cheek and really anywhere on the face. But I particularly like it for lower eyelids where the skin is thin and we want to reduce the risk of swelling and bruising. The big advantage to the cannula is it's reduced the risk of bruising by about 80 to 90%. It's really rare to get any bruising. So sometimes we'll use the cannula for the lips as well, or other areas where we want to really reduce the risk of swelling and bruising. And in the face, those areas are typically the lower lid and lips. Also, the cannula is nice because it's very, very delicate, small and flexible, and generally the patients feel a lot less with this procedure. So this is an office-based procedure. We just use a little numbing cream. We fill it in, and patients see the results immediately.